The modern healthcare environment in which we work is a complex and sometimes chaotic one. Crisis Resource Management, or CRM, embodies a generic set of skills which give us the ability to deal with complex situations in a logical manner. Calling for help is a vital part of CRM. Recognizing that you're in a situation with a small margin for error is crucial. But calling for help doesn't mean necessarily calling your senior or your next in command. There are many other members of the critical care transfer team, including doctors, nurses, porters, ambulance crew. When we look at what makes a smooth and successful transfer, so much of it has to do with good anticipation and planning. Yes, we could anticipate every potential disaster and plan for it accordingly, but we can't take everything with us, including the kitchen sink, because we have limited time and limited resources in which to do so. Therefore, we have to rationalise what we take with us. Well, critical care patients are usually on multiple infusions, but you've got to ask yourself which of these are essential for the patient's survival and which can wait until their arrival at the receiving unit. So many of the decisions we make in this area are heavily influenced by the estimated duration of the transfer. Now, liaising with the ambulance crew is an easy way of finding out this information. Accordingly, you must prepare enough of your life-saving infusions to go with you for the journey, including a spare infusion pump primed and ready to go should one of them fail. Now remember, you're about to depart from your place of safety where you have everything at your disposal. So please ensure that if you require anything or may require anything, such as a chest drain, an endotracheal tube or blood products, that you have them in place before your departure. Before you leave, it's also worth remembering to have a plan in place for your return journey. Situational awareness is a very interesting feature of human performance in complex environments. Now, it describes a set of skills which allow us to continually reappraise the whole situation in a logical manner. You usually find that the best leaders have excellent situational awareness skills, as they allow themselves to take a step back and look at the bigger picture. For example, how many times have we been there when the oxygen saturation monitor is alarming and everybody becomes fixated on the probe and the monitor, when what should be happening is one person is delegated to investigating the probe and the monitor and everybody else engages in a rapid and thorough reassessment of the patient in an ABC manner. With particular reference to critical care transfers, the question, do we really need to transfer this patient, is an important one to ask. Situational awareness plays a vital role in appreciating that sometimes the transfer of critically unstable patients may not be the most appropriate course of action. The important thing to understand also is that situational awareness skills are easily learned and put into practice immediately. Now, communication is at the cornerstone of effective CRM. The reason being that 70% of patient adverse events have communication failures at their root cause. Examples of good communication include directing requests to named individuals whilst maintaining eye contact with them and asking for a response. Rather than asking everybody and nobody at the same time, can I have an arterial blood gas please? Why not look Andy in the eye and say to Andy, Andy, can I have an arterial blood gas please? And could you let me know what the result is? As we all know, non-verbal communication is just as important, and documentation is a key component of this. Aid memoirs and checklists provide a useful way for the brain to cope when dealing with lots of rapidly changing information. And this is one of the reasons behind the layout of the network transfer form. It presents the user with a useful A through to P checklist to ensure that all the necessary components have been completed prior to departure. The form also presents you with a clear and easy route of communicating with the network about any issues you may have experienced during the transfer. So hopefully these can be addressed and avoided in the future. Visits to the CT scanner or MRI scanner present their own unique problems, not least of which is that they are usually situated in isolated parts of the hospital. The MRI scanner is also very well known for turning metal objects into potentially lethal missiles. We've all heard that story of the oxygen cylinder flying across the room. Another potentially unfamiliar environment is the ambulance bay itself, so familiarise yourself with it beforehand. Not all ambulances are the same. For example, do they have piped oxygen? And if so, how much? Do they have inverters that will power your equipment? And do they have a defib on board? Also, who is going to be accompanying you on the transfer? And what are their skills? What will they be able to help you with during the transfer, should you need them? So you've conducted a safe transfer and you've reached your destination, but don't fall at the last hurdle. Check before leaving which is the best entrance to get into the hospital, and if necessary, is someone there to give you access? Which floor is the receiving unit on, and which is the best lift to access it? This encompasses many of the skills which we've already described here. Now, examples of resources include equipment, personnel, or reference material. This reference material may be telephone advice from an expert, or the trusted network transfer chart. Finally, and by no means least, is the concept of leadership. However, don't confuse leadership with seniority. The two are not the same thing. Why is leadership so important? Well, good and strong leadership facilitates a cohesive team. And a cohesive team is one which feels empowered to speak up. And as we've heard earlier, communication is a vital component of crisis resource management. Crisis resource management skills are not just there to be used once a crisis has arisen, but should be used at all times to avoid a crisis happening in the first place. Remember, prevention is better than cure.